Vital signs are crucial indicators of health. They provide essential information about a person's overall condition. Doctors and nurses rely on them to monitor patients' health status. These signs act as vital clues. They can indicate if someone is unwell or recovering. Accurate measurement of vital signs is essential. It helps us understand the body's internal state. We use these signs to make informed decisions about patient care. For example, a high heart rate can signal stress or infection. Low oxygen levels might indicate respiratory issues. Blood pressure readings can reveal heart health. A fever can be a sign of infection or illness. Understanding and interpreting these signs correctly is vital for effective healthcare. Before we begin, we need the right tools. These tools help us measure accurately. For temperature, we use a thermometer. There are different kinds of thermometers. To measure pulse, we use our fingers. We gently press on certain spots on the body. For respiration rate, we watch the chest move. We count how many breaths someone takes. To measure blood pressure, we use a blood pressure cuff. It has a gauge that shows the reading. A stethoscope is essential for listening to heart and lung sounds. A pen light helps us check pupil response. A pulse oximeter measures oxygen levels in the blood. A reflex hammer is used to test reflexes. A glucometer measures blood sugar levels. A tuning fork helps assess hearing and vibration sense. Let's start with temperature. Place the thermometer under the tongue. Ensure it is positioned correctly. Wait for the beep, indicating the reading is complete. Next, let's measure the pulse. Place your index and middle fingers on the wrist, just below the thumb. Count the beats for a full minute. Make sure to note the rhythm and strength. Now we'll check the respiration rate. Watch the chest rise and fall. Each rise and fall counts as one breath. Count each breath for a minute. Note any irregularities. Finally, we measure blood pressure. Wrap the cuff around the upper arm. Ensure it's snug, but not too tight. Inflate it, and listen for the heartbeat. Record the systolic and diastolic pressures. Accuracy is important when taking vital signs. Make sure the tools are clean. Follow the steps carefully. This ensures the measurements are correct. Proper technique is crucial. It gives reliable results. These signs are vital for understanding a patient's health. Double-check readings for accuracy. Explain procedures to patients to ensure cooperation. Calibrate equipment regularly. GAP2S. Mistakes can happen when taking vital signs. Recognizing and avoiding these errors is key to accurate readings. GAP2S. Ensure equipment is calibrated. Position the patient correctly. GAP2S. Take your time. Count pulse for a full 60 seconds. GAP2S. Clean equipment properly. Explain procedures to the patient. GAP2S. Avoiding these mistakes ensures accurate vital signs. This is essential for patient care. GAP2S. Now that you've mastered the technique of taking vital signs accurately, it's crucial to understand how to interpret these readings and what they might indicate about a patient's health. GAP2S. Let's start with blood pressure. A normal reading is typically around 120/80ths mmHg. Readings consistently above this range may indicate hypertension, a risk factor for heart disease and stroke. Conversely, readings below 90/60ths mmHg could suggest hypotension, causing dizziness and fainting. GAP2S. Moving on to heart rate, a normal resting heart rate for adults ranges from 60 to 100 beats per minute. A rate above 100, known as tachycardia, could indicate stress or an underlying condition. A rate below 60, known as bradycardia, might be normal for athletes but could also suggest a heart issue. GAP2S. Next, let's discuss respiratory rate. A normal rate for adults is 12 to 20 breaths per minute. Rates above this range may indicate respiratory distress or conditions like asthma or pneumonia. Rates below this range could suggest central nervous system issues or respiratory depression. GAP2S. Temperature is another vital sign that can provide valuable insights. A normal body temperature is around 98.6 degrees Fahrenheit, 37 degrees Celsius. A fever above 100.4 degrees Fahrenheit, 38 degrees Celsius, often indicates infection or inflammation. Conversely, a temperature below 95 degrees Fahrenheit, 35 degrees Celsius, could indicate hypothermia, a medical emergency. GAP2S. Understanding these readings and their implications can help you make informed decisions about patient care. Always consider the patient's overall condition and consult healthcare guidelines or professionals when in doubt. GAP2S. By accurately interpreting vital signs, you can play a crucial role in early detection of potential health issues and ensure timely intervention. This not only improves patient outcomes but also enhances the overall quality of care. GAP 2S. Congratulations on completing this vital signs tutorial. Let's recap the key points. GAP 2S. We discussed the importance of vital signs in assessing health. Understanding these measurements is crucial for early detection of health issues. GAP 2S. We covered the essential tools and proper techniques for accurate readings. Practicing these techniques ensures proficiency and confidence. Avoid common mistakes and troubleshoot issues effectively. Interpret results to make informed decisions and provide better care. GAP 2S. Thank you for joining us. Stay tuned for more content and don't forget to like, share, and subscribe. Until next time, take care and stay healthy.